Last week, the Centers for Disease Control and Prevention issued a warning related to e-cigarettes and vaping. The government agency is investigating the booming industry, which is still relatively unregulated. Now, on October 17th at 7 o'clock in the evening, New Mexico PBS will air the documentary Vape. As part of that broadcast, we interviewed two public health experts about vaping. NMIF producer Matt Grubbs did those interviews last week. But because there's so much vaping news happening now, we're bringing one of those conversations to you now.
Thank you for joining us. We are talking to a pair of public health experts about vaping. There's a documentary called Vape by Chris Schuler Productions that is coming to New Mexico PBS in October and our sister stations around the state in September, exploring sort of the impact and the rise of vaping. And Shelley Manlev, who's a public health consultant, spent 20 years working with Santa Fe Public Schools. Thanks for coming in.
Thank you.
You bet. And Dr. Sean Sadhu, who works at the University of New Mexico as a child and adolescent psychiatrist. Thanks for coming in as well.
Thank you.
We have talked about a lot in our conversation, which we'll see again for viewers this fall. I wanted to get with, as we speak, it's the end of August, and the federal government is still sort of trying to get its arms around how to regulate, what to do. Shelley, I'll start with you. You've said that you feel like we've been caught on our heels as a society, from kids to parents to principals to public health experts to the federal government. Can you give me an overview of where we are in terms of regulation?
We are not far enough is where we are in terms of regulation. We still have flavored e-cigarettes, flavors like cotton candy and creme brulee and, mango and tropical fruit, things that are designed to appeal to children.
Things that have been banned in tobacco.
Absolutely banned. Advertising that has been banned in terms of tobacco. When's the last time you saw, none of you have seen tobacco advertisements on television. However, e-cigarettes can be advertised in all kinds of ways. Sponsorships, there's just, for a lot of reasons, and I think, part of it, there's something called the precautionary principle, where the idea is you decide to withhold something until you know it's safe, and in the case of e-cigarettes, we've allowed the e-cigarette companies, and now most of whom are owned by the big tobacco companies, to do everything without regulation, thinking that eventually the science will catch up. And we know that science is being kept quiet. Unfortunately, right now we are seeing a spate of serious lung diseases. There are so many effects on the heart, on addiction, on cancer, on the body that we just don't know. And instead of going, this is a serious product, this is a chemical, a drug that we are, it's not just a vapor, it's actually an aerosol with droplets of particulates that are being inhaled into growing lungs, right? The lungs of 11 and 12 and 13 and 15 and 18-year-olds. So there's many, many reasons to be concerned, but our government bodies, I think, have been, partly overwhelmed by the corporate interests, as often is the case, and have been hesitant to take strong steps, measures, without having years of data, and long-term results take a long time to get.
Dr. Sadhu, to what extent do you think can the public health community drive perhaps the need for regulation or the science behind those regulations?
With cases like these, 200 serious lung illnesses coming up, I would imagine if we could sort of capitalize on just the public health concern and show people like, look, there actually are some serious things happening and we're not even sure what it is. The CDC is investigating it, that potentially that could be a way to have more of an advocacy effort. Going back to the other point about marketing is that, Juul and other e-cigarette companies are marketing on Snapchat, Instagram, things that potentially parents may not be on or be aware of. And so social media advertising is something that's different, potentially less regulated than television marketing, which may be more regulated. And, a lot of these concerns are that kids are able to access, buy these sorts of things online without proper identification, without checks and balances. So it's not as if a kid is walking into a store and sort of with a false ID and getting these. They could be getting them from friends, but they could also just be getting them online without much in terms of checks and balances that way.
And this is, was it Juul who just sort of voluntarily said, hey, guess what, we're going to not let people under 21 or 18.
Right, we're going to have better checks.
Okay.
Right, and Juul, in fact, which is the largest distributor and seller of e-cigarettes, has also voluntarily agreed to do a number of things, and they're promoting that you can't buy these devices unless you're 21. But I think one of the things that we should all know from our history of big tobacco, you cannot trust the tobacco companies to do right by us. They have their profits that are at stake are so great that, they are doing these, I think, more as public relations events. The laws that ban sales to 21 do not have a huge impact. In fact, unfortunately, often they make things even more appealing to our teens when something is banned. We need, as a nation and as particularly, I think, our adults, to recognize that ingesting substances, especially through the lungs, in a vapor, through a heated coil, something heated and taking in, is something to be considered and taken very seriously. And we want our parents to know this is not a benign device. This is not something that's not only is it going to cause a nicotine addiction for a lifetime. Our kids, when you're 13 and 14, you get addicted to nicotine so much faster than you did if you were to pick something up at 26 because of the developing brain, that this is something that we want to help our children make the best decisions about. Be aware that they are being influenced. Even ask them, you talk about talking to your kids, what kind of ads are you seeing about e-cigarettes? What do you know? And then the other piece we need to be aware of is we have no idea what they are inhaling, and that there's more and more inhaling of high concentrated THC. And it seems like that is particularly dangerous in terms of immediate and acute illness.
And I want to pick up the drug aspect of it. First, Shelley mentioned it's easier for kids to get addicted to nicotine, but the potential damage from vaping, drawing not just the nicotine but whatever else is in that into your lungs, is that more acute for children?
Yeah, it could potentially be. It's hard to say.
Okay.
But there's a lot of data out there. Sometimes folks will say, well, if you're vaping, at least there's not all of the other stuff that you burn with tobacco, and therefore it's safer.
Right.
But nicotine in and of itself is not a safe compound. Even if we were just to ingest pure nicotine on its own, it causes more mutations in cells, which mutations can lead to cancer. And it also causes vasoconstriction, the nicotine itself, so that means our arteries get smaller. So that can damage all of our end organs, which is like heart, lungs, kidney, liver, stuff like that. And then all of the sort of dental, gum disease, tooth decay, that's all because the nicotine itself is causing those blood vessels to clamp down. So you have dry mouth, and your teeth don't get enough oxygen. So all of that small blood vessel damage that is associated with tobacco would be any product that has nicotine in it.
Okay.
And naturally, the younger you are, when your body and your brain are still developing and you're using these harmful compounds, it's not going to be safe. One thing for parents to know is, if the parents themselves are vaping, right now children are seeing it, is it being modeled? And so at least if the parents know this is not safe for my developing child, and uses the same precautions that they would use for secondhand smoke, such as smoking outside of the home or outside. At least that's some progress. Whereas if we're vaping in the home, or hopefully not offering vaping to the children, or just not really monitoring it, then the kids have access, and there's not really a concern about it because someone in the family is using it.
Okay, let's finish up with this concept of modeling. Is that a strong sort of pathway for influencing kids?
Oh, absolutely. Yeah.
Regardless of the behavior, I'm assuming. But.
Absolutely. It doesn't necessarily have to be parents. It can be any concerned adult. It could be a teacher, a Little League coach, a pastor at church, any sort of concerned adult that actually takes an interest in a child, and sort of that child will then say, okay, this person cares about me. Now I'm going to listen to what they're sort of saying. And having that open dialogue we were talking about with the kids, that probably is the greatest driver of change.
Okay. And schools, it seems like, are waking up to this in large part.
Unfortunately, schools are being forced to wake up to this a lot sooner than everybody else, because the amount of time that principals and deans and assistant principals are having to spend, a vast majority of the substance use violations on campuses are e-cigarette violations. It is an opportunity for schools, because I think many of the young people who are using e-cigarettes need support. They need help. They need it a chance to be educated, not just about e-cigarettes, to be screened for mental health issues, possibly to get positive supports and activities in their lives. So there's a program funded by the state called 24/7 New Mexico that is working with schools to strengthen their policies, but also to provide supportive, healthy interventions, right, that really help these young people who unfortunately may be on a path that's not heading them in a good place, but really with the proper support, with mentoring, with education, and re-engagement in school, that they can actually have a better life.
That's a great point. If I could piggyback on it, alternative peer groups are huge in adolescent substance use. So what that means is a lot of times the kids don't want to give up the substances because that means they have to give up their friend group.
Oh, okay.
And so an alternative peer group basically means that you're organizing a peer group where there's a premise that everybody there is drug-free, but they're still doing really fun things. They're going bowling, they're going hiking, they're playing sports together. So now all of a sudden you have a group of friends, and so you're not isolated and you're not lonely, and you don't have to use to do fun things. So it could be anything, just sort of getting kids more engaged in life, engaged in their community, engaged in school. Those are all ways to get away from the substance. Substance usually goes along with isolating. Sometimes it could be self-medicating a mental health issue, in which case getting them treated, getting them to therapy, family therapy if there's some conflict at home, or if there's a history of abuse. So there's all kinds of things where our mental and emotional, you could even say spiritual health is tied into substance use. And the more you work on those other factors as well, there may not be this draw that I have to escape through this chemical, that my life is actually worth living as a life in and of itself, and I don't need to run away from it.
Sean Sadhu, Shelley Manlev, thank you both for your work and for agreeing to come in here. We appreciate it.
Thank you.
Thanks.